Well, looks like people are joining us. Hello, everyone. So as people are getting on, I personally wanted to share a fun poll to start, since sometimes webinars are not as fun as we'd like. So I'm asking everyone to share your favorite quarantine pastime. There were no options for you to enter in your own choice, so just trying to choose from what I have thought of as quarantine pastime. So we are going to give it just a few minutes for anyone else to join the call. It looks like people are joining pretty quickly. No one for puzzles yet.
How many puzzles have you done, Sarah?
I think 5, but I'm sure Gwen has done more. Great. Let's give it maybe 1 more minute before we get started. If you haven't taken the poll yet, you can take it. It looks like I added naps. That looks like people do enjoy naps.
Naps?
Yeah.
I thought you said math.
Yeah, oh no, we're not doing math in quarantine.
I do working at special problems, math problems.
Good. We have almost everyone. If you just joined and you want to take the poll, feel free to do so.
Dina said
we forgot eating cookies.
Yeah, that was a good one.
Yeah, I did forget snacking. I've had a lot of chocolate. Okay, thank you all for participating, sharing the results. It looks like cooking is preferred. Interesting, it's not my preferred. But thank you guys for doing this. It just lightens it up. I am going to turn it over now to Susan Lurch to get us started.
Thank you, Sarah. And I have to say, for my husband, it's probably cooking, and for me, it's Netflix. And cookies, probably, and snacking. At any rate, I'm Susan Lurch, HFM's Executive Director, and I'm grateful for the opportunity to welcome you to our webinar, Shifting Perspectives, Advocacy During the COVID Pandemic. And I really want to thank Sarah Precario. Sarah is our Advocacy Director, and this is her show to some degree, and she put together all of our speakers and invited you, and got material up on the website. So here you go. We're glad you're with us, and Sarah will do the rest of the introductions and thank yous.
Well, thank you, Sue.
There you go.
Well, thank you all for joining us. You know, we always want to share a very special thank you for our sponsors, Genentech, Takeda, Novo Nordisk, Pfizer, Hemophilia, and Sanofi Genzyme. As advocacy has changed, looks a little different, we're really appreciative that they are still here with us in this different format. So with that, I'd like to give Keith Fish a few moments here to share some remarks with us and hopefully get us in that advocacy mood. So thank you, Keith Fish from Takeda.
Thank you so much, Sarah, and thank you, Susan, and to the entire HFM staff. It's always a pleasure to speak to you all. I wish it was under a little different circumstance and we were all in Lansing together like we were last year. Sarah, I just want to jump back to the poll question you asked. Unfortunately, panelists could not vote. And since I I know, seriously, since I think I gained the COVID-19, I would have to go with eating. So that's probably my pastime. That and Disney Plusing like a champ. So not so much Netflix, but anyway, but no, thank you so much for the opportunity to join on behalf of Takeda. It is a true pleasure, and it's always, advocacy is always so near and dear to our hearts with Takeda. So we're glad to continue to be a sponsor for you all. Since COVID-19 has hit, there's a lot, obviously, that's taken place within all of the hemophilia chapters, but also within the manufacturers, and impacts everybody. You know, obviously, you know, we at Takeda instituted basically a travel ban from the beginning of March, and at the time it was a 3-month travel ban for all staff, and everybody thought we were a little crazy at the time to go 3 full months saying no travel ban, and now that's kind of looking like, I wish it was only going to be 3 months, but it looks like it's probably going to be a little bit longer, just given where all the various states are from that standpoint. I think the one thing that I'll say about advocacy right now is especially during the time of the pandemic that's in front of us, it's now more than ever, it's important to have our game faces on and know exactly what we want to say to these legislative folks, because we're going to have them more than likely on the phone or in a video chat or on a Zoom call or something like that, and having your clear and concise message about what you want to say to each one of those people to get your points across is going to be so pertinent during these times. And you might have some unprecedented access to them as well, because a lot of the legislators are still at home and not in sessions yet. So you might have some additional opportunities to get in front of those folks. So I just think it's a unique opportunity, and I'm so proud of what HFM is always continuing to do. And Sarah, you're leading a great ship here. So it's my pleasure to be here, and I appreciate the invite. Thank you.
Well, thank you so much, Keith, for joining and making that great point that as things are different, there are also some opportunities with that. So before I turn it over to 2 of our other guest speakers, I just wanted to share with you all a bit about where HFM and our advocacy work is right now. You know, normally with our program, we've built up a nice, robust year-round advocacy program that includes in-person meetings in Lansing, meeting with stakeholders, community trainings, joining other events, working with coalitions, a lot of time with other people. And also our biggest advocacy event every year, Lansing Days. And unfortunately, we had to cancel that event, of course, because of safety concerns for everyone. And it's still a little bit sad, right? Today would have been the evening training of Lansing Days, but it is very nice now to be able to have shifted. This is not the same as gathering together at the Kellogg, but I am still very happy we have people joining us from all over the state and sometimes out of the state to be here. So while our advocacy looks different, we are not meeting with legislators tomorrow. Today, we are going to talk about a few things that the state has done, a few changes they have made, talking about ways that you can still get involved with us. So even though we're working from home, HFM is still able to communicate with all of our members, communicate with other stakeholders. We recently did have our advocacy committee call. We're continuing to monitor all policy and access to care issues. So like always, please remember that you can come to us if you do need anything. One item, one policy priority that we have been quite focused on up until the pandemic and even now is a bill in the state legislature, currently in the Senate, called Senate Bill 612. HFM has been working with the Health Can't Wait Coalition, a group of other nonprofit organizations and physicians, to push this step therapy and prior authorization reform. And so if step therapy and prior authorization are these words that you're not really sure about, what this bill is really trying to do is put patients first and get rid of delays to care, make sure that you can get your physician prescribed medication. But as you can imagine, that was put on hold, right? As our lives have shifted, so have some priorities. So individuals, businesses, and governments are focused on these essential needs and essential services. So the legislature has put on hold some of their legislation, and that now they've started focusing on the pandemic. You know, as some time has gone by, however, this will come onto their plates again, and we want to make sure that our community is still thinking about it. As Keith said, we want to make sure that we are guided, that we're strong, and that we are ready to go. So a little bit later in the webinar, after we finish some of these updates for you, we're going to give you really clear ways that you can get involved, that you can continue to stay involved with HFM's advocacy work. With that, I am very happy now to introduce our two guest speakers. I wanted to give you all an update on what the state is doing because, of course, during this time, we are having a lot of changes, right? The state is changing things, businesses, there are all these different executive orders, and I wanted you all to be able to know what is going on that's most pertinent to you. So as individuals with bleeding disorders, I wanted to invite speakers from the Michigan Department of Health and Human Services. So today I'm very, very happy to introduce Jackie Prokop, Director for the Medicaid Program Policy Division, and Theresa Christner, Manager for Children's Special Healthcare Services Policy and Program Development Section. Jackie is going to start us off, and then Theresa will come in. If you have any questions at all during this time, please add them into the Q&A box. Try to add them there. There's also a chat. It just helps if we can get all of those questions in the same area. I will be monitoring it as they speak, and if we don't get to it during the talk, right after they finish, we'll answer some of those questions. So now I'd like to turn it over to Jackie.
All right, thanks, Sarah. I appreciate that, and thanks for allowing me to be a presenter today. So I'm going to be focusing on all the COVID-19 related policies that we have released since March 8th, and there's been 15 of them. And I'm not going to go into each one of them in detail, but I do want to kind of introduce what our focus has been since all of this started. And one of our primary concerns have been access to healthcare, and also recognizing that there may be limitations to access healthcare in the sense of maybe patients not wanting to have face-to-face visits, so thinking about other ways to still deliver healthcare services. So I'm going to just talk about policies and highlight what it is what the purpose of them are. So one of the first ones we sent out, which is actually on March 18th, the title of it is Relaxing the Face-to-Face Requirement. And by the way, if you go onto our website where all of our policies are, what we decided to do very early on is anything that was COVID-19 related or a quick change like that, you'll see in our subject line, it says COVID-19 response. So you'll see there's 15 policies with that. All of the policies that we put out for a dual public and final comment, which means the minute we posted it, that policy became effective. One of the things that we are required to do for our policies is also to put them out for public comment. And because all of these policies are very positive, they became effective. And we also are allowing people to send in comments in case there's something else maybe that we missed, or something else that would help to make providers' life or beneficiaries' lives much easier during this time. And within all the policies, we do indicate that these policies are time limited, and they're connected. They may be connected either with the federal emergency declaration expiration date, or with the state emergency. That's not really an expiration date, but when the emergency ends. And our policies also indicate that we will be coming out with another policy once either the state or the federal has ended. Some of these policies are tied to the federal side, and some are tied to the state, because there have been some executive orders that have come out from the governor. So the first is indicates it's relaxing a face-to-face requirement, and this really deals with individuals in a nursing facility where there has to be it's a face-to-face meeting to do an assessment and make sure all their needs are met. And because obviously with COVID-19, it tends to disproportionately impact the elderly, there was a need to make sure that services were provided and to prevent having to have that face-to-face contact. So where possible, where services could still be delivered, we relax that requirement. The next one is called like a telemedicine policy expansion. And what this allowed providers to do is we actually sent out an early telemedicine policy, which is the typical where you have the audio and the visual. And it's like a Zoom session. You have a provider up on the screen and you talk to them. Well, there was a concern that many beneficiaries may not have the ability to have the visual part. So we are actually allowing telephone-only visits. And we do allow this for many different providers, whether it's a social worker or a physician. This is something that's really going to be time limited to the COVID-19 crisis. But this is why we did it, and we're finding many other states and the federal government's very supportive of this, and other insurers are doing it as well. So there again, making sure that, and we've heard a lot of feedback that people just aren't comfortable going into the doctor's office. So having the ability to do telemedicine or telephone has widely been used. Then there's another that talks about options used for nursing facility beds, and there's some flexibility that's been put in there. The next one is home delivery of DME and medical supplies. What we generally did is we relaxed some of our prior authorization requirements. Some of them require people to work with a physician and then put an order in and to have like a face-to-face visit or to sign a form. But what we basically said is that a physician now could call that in, and we kind of cut some of the red tape, so to speak. And people aren't required to sign things. They can leave something on the porch if needed, or if they bring it in, they keep their distance so they can continue to do social distancing. So we relaxed a lot of those requirements. The next one, which is MSA Policy 2018, it speaks of relaxing hospital transfer and related transportation. So with our current policies, we do not allow hospitals to transfer patients between two hospitals unless the second hospital can provide a service that the first one cannot. But being that there were some hospitals, like in the Detroit area and other areas where there's a larger population, if those hospitals started to fill up, we allowed them to move patients to other hospitals to make room for those that were more sick. So that's kind of in a nutshell what that policy is. On April 1st, we released another policy that says if somebody comes in and has COVID-19, they will have no office copays or any copays for COVID-19 related services. We tend not to have copays on labs or other types of services, but office visits, some ER visits, and pharmacy services, we have copays on them, but if they're related to COVID-19, they're exempt, and we will not charge copays. The next one is suspending all Medicaid closures. So what this means is anybody that was eligible for Medicaid in the month of March, they will not lose Medicaid until all the COVID-19 stuff is completed, when the emergency declaration ends. So if somebody's on Medicaid right now, and let's say they have a higher income and they no longer meet our eligibility requirements, they still stay on Medicaid until, I believe it's until the federal government has indicated the emergency is over. So our Medicaid rules are definitely going to go up a lot to that. And also just kind of anecdotally, obviously a lot of people have been laid off from their jobs. We have had an increase in Medicaid applications. So if any of you are working with people who are on Medicaid, and maybe there's been a change in income and you think their eligibility should have ended or not be on Medicaid anymore, well, this is why. And we do have another policy that's going to be coming out that talks about our redetermination process. We're suppressing that. We did send out redetermination letters. Can I stop right there? Can you hear me okay? Sarah?
So I can hear you, Jackie. There's just a little bit of background noise.
Okay, sorry, I was just getting a little note that said my speaker wasn't reading or wasn't working well. That's just, I double checked. I'm gonna reposition.
It sounds a bit better right now.
This is better? Okay, sorry, let me know if that happens again. So anyway, with redeterminations, we did send out letters. It's like a system that's generated, and things get generated like a month or two in advance. So some of them may have gone out in the last few weeks. But going forward, those will stop as well. So if you're working with somebody who's on Medicaid and you're wondering why they're not getting their renewals in the mail, it's because we stopped that process, and they'll continue to have eligibility throughout this time period. And we will start doing renewals well into the future, but it may be a little while yet. There's a policy that talks about regional hubs with the nursing facilities. This is where certain nursing facilities dedicated a part of their facility for people who are positive for COVID-19. We have another policy that's related to sort of telemedicine for dentists, that there is one code. Many dentists are not seeing people for preventive measures. They're seeing them if there are issues, but we also activated a telemedicine code that dentists can use. And then we had some updates on our non-emergency medical transportation. We just, basically what it's doing is it's relaxing a lot of guidelines. There are certain things that people have to do in order to make sure their transportation's covered, and we relaxed it during this time. The next policy talks about temporary suspension of certain provider enrollments. And then there was an executive order that came out that allows certain providers to order COVID-19 tests, which they typically don't. So we indicated that our policy is following that executive order. And the relaxing of the provider enrollment is simply providers are supposed to come in at certain times, like periodically, and update their information. And just during this time, if for some reason they were due to come in last month or last week and they didn't, we would still allow their claims to go through the system and there wouldn't be a problem. So we're just relaxing that throughout this time. We will, again, catch up in the future. For kids in school-based services settings, of course, I know they're not in schools, but the schools do still provide some health care. We're allowing them to do telemedicine as well, and we're talking about how we've changed how the reimbursement structure will go for them to keep up with things. Then we sent out another policy allowing telemedicine for physical therapy, occupational therapy, and speech therapy. This does have to be done with both the audio and the visual. They can't just do telephone for this, but that policy came out recently. There was one for CSHCS that came out relaxing some of their eligibility requirements, and I'm going to let Theresa speak to that. And then the last thing that we have is the emergency services. For people that have something called ESO, that means that they don't meet our citizenship requirements in Medicaid. And so they only get like a small benefit package where just it's emergency care, whether it's in the ER or in the hospital. What we did is we allowed that if somebody went to see their physician, for example, and they had COVID-19, because that can lead to an emergent condition, we will be covering those services for those individuals. So that's, I ran through it really quick, but it gives you a flavor of all the different areas that we've looked at and made policy changes. And we do have a couple more still yet to come out. But again, if you're looking at them, they're out for a dual public and final, so you can still make comments on them. And if there's something that we missed, please let us know. We've written a lot of policies in a very short time frame. So I'm going to stop right there. I don't know if Sarah has any questions or if we're going to turn it over to Theresa at this point.
Thank you, Jackie. We only have one question so far, and it is related to CSHCS. So we'll leave it, I think, until Theresa starts talking and see the best time to answer it. Thank you so much. And again, if you still have questions during Theresa's talk about Medicaid and any of the new policies, please feel free to share your question. So up next, Theresa.
Hi, thank you so much for inviting me. I'm just going to go over a high-level overview about CSHCS, which stands for Children's Special Health Care, our services, and what our response to COVID-19 pandemic has been. Basically, we've been implementing various policy and procedural changes, and we think we've accomplished a lot over the past 2 months. For one, we have moved almost 100% of our workforce home, which has been really quite a feat. This has allowed us to make sure that we are continuing to process enrollments and renewals and various other program requests. We are allowed to do that because we have really a very good automated system. And by doing so, we are adhering to the governor's social distancing orders. And so that, again, is something that was important that we've accomplished. And number two, we've extended the medical review date by 12 months for most clients who have or had a medical review date between February 1st and July 31st. I say most because there is a small limited number of codes. Mostly those are associated with newborn diagnoses where conditions typically resolve within a year, and as such, clients with those codes do not need to have their medical review dates extended. So by extending the medical review date by 12 months, we're hoping to address concerns that people may have about having to go for routine or non-urgent health care appointments. That was a concern that has been shared by many. It should be noted, however, that there is a second part of our review process, which is a financial review. That portion has not been extended. The financial review component is still in place and needs to be completed within the current 12-month time frame. So, but we're really working to align with Medicaid on this and making sure, as you heard Jackie talk, this whole idea about making sure that vulnerable people do not lose their health care coverage. Number 3, we are suspending income audits. So each month, CSHCS runs income audits on a subset of our client population to verify the incomes that are reported to the program. This is through that financial review process. So during the pandemic, we are suspending those income audit processes, so no one will be held, will be hurt through that process. Number 4, we are suspending what they call the temporary eligibility period, or TEP. All CSHCS clients who are in the lowest payment agreement category, these would be our Title V clients, those who are paying only $120 per year, they're required to pay for, apply for Medicaid coverage. And normally these clients are placed into what they call a 90-day TEP period. And then once they have applied and we verified that they've applied for Medicaid, then we remove them from the TEP and they receive a full year's worth of coverage. But the people responsible for supporting families that are in the TEP and making sure that they apply for these Medicaid benefits, those fall upon the shoulders of our local health department staff. And given that they have additional demands placed upon them related to testing and contact tracing, we decided that we wanted to suspend the TEP, and instead clients who would normally have been in that TEP will be receiving a letter that encourages them to apply for Medicaid. But again, no one will lose coverage if they do not apply for Medicaid during this period of time. Number 5, we are allowing for eligibility and renewal of medical reports to be submitted by advanced practitioners. Now, this is a change. Per our policy, CSHCS requires medical reports to be signed by pediatric subspecialists. And as part of our efforts to assure healthcare access and continuity of care for our clients, during this period only, CSHCS is temporarily allowing nurse practitioners and physician assistants that are practicing within the office of an approved pediatric subspecialist to sign and submit medical reports that document both the eligible diagnoses as well as the severity and chronicity of the conditions. Again, this is for both initial eligibility and renewal determinations. Number 6, we are allowing for an electronic signature process of medical reports, or what they call the MERF, the Medical Eligibility Review Form. Those documents that have electronic signatures are accepted when accompanied by the appropriate medical reports. And this is our way of accommodating medical staff that may be working remotely during the COVID-19 pandemic. And then 7, we are allowing our CSHCS customer support section analyst staff to grant emergency exception requests. And these are created based upon on a case-by-case basis to extend coverage when coverage was either lapsed as a result of COVID-19. So for instance, if a client is quarantined and therefore was unable to provide the required renewal information, it may be that they coverage lapsed back in January and now they find themselves in this COVID-19 situation, or it could be that they had their coverage, they couldn't provide their financial documentation at this point. We are going to go ahead and extend their coverage to assure access to care and that they get the medications that they need. And then also, we've made some changes with our non-emergency medical transportation services. And so that's number 8. Our CSHCS state staff will temporarily waive the NEMT, non-emergency medical transportation prior authorization requirement if a local health department is unable to approve the transportation request before the qualifying travel takes place. And this is, again, a real change. And additionally, our state staff will be waiving the requirement that mandates that these requests for travel reimbursement must be received within 90 days following the authorized month of travel. So these are all procedural and policy changes that we've made. In addition to promulgating our CSHCS policy, which is MSA 2024, which is posted for public comment right now and addresses the TEP issue specifically, as well as the submission of documents, medical reports for eligibility and renewal purposes by practitioners and physician assistants. We have been working to align with Medicaid, and we have been also working in conjunction with them and making sure that our clients are represented during important policy discussions. And so we have been engaged with them as they've talked about the durable medical equipment policy changes and about the various pharmacy items, about how we can expand use to telemedicine and relax those face-to-face requirements, as well as streamlining that prior authorization process. And then in addition to that, we're also working with our local health department staff and our specialty clinic providers, like our CMDS clinic providers, to assist them as they work with their clients and they're looking to implement these policies. And altogether, we're hoping that this kind of creates this whole complete response, a comprehensive response to COVID, by which we are putting in the appropriate safeguards and mechanisms to protect the health of our clients and to promote their personal safety during these challenging times.
Thank you, Theresa. It's really quite amazing to hear all of the policies that CSHCS and Medicaid have written and introduced in such a short time to make sure everyone's safe and can still receive care. We do have one question in the Q&A that addresses cost and wondering if there's any concern in children's special health care services about costs and looking to find savings.
At this point, we are not looking at that level of cost savings. We're more looking at things that we can do that we think are going to safeguard our populations. So right now, the state has implemented a cost saving strategy by which many state staff are accepting a layoff, and in that, we're participating in that. We're laid off 1 day a week for the next 10 weeks. So it goes from this pay period, or I guess it's, let me think, the 15th of May through July 25th. And so that is one of the reductions efforts that I know that are in the works. We've also done some reductions as it relates to some of our contracts to make sure that we have appropriate, we're really utilizing the state's funding in the most appropriate way. So we're looking for what we consider to be appropriate reductions in those areas.
That's great. So far, no reduction in who you are covering?
Nope, not yet. Not for us. Not according to what I am knowledgeable about.
Okay, thank you. We have one more question, an anonymous question asking if you could explain the benefit of CSHCS to the hemophilia community, and I will say bleeding disorders community.
CSHCS provides medical care and treatment for people who have been diagnosed with hemophilia and some other bleeding disorders, specifically those other bleeding disorders when they're considered to be chronic and severe, and require specialty care and treatment. So what we do is we provide a benefit by which people can access specialist care, can access pharmaceutical products, any kind of equipment that they might need related to that specialty care. For CSHCS, we cover hemophilias from the time of diagnosis all the way through their life. We do that in past, for most of our program, the program ends at age 21, but for hemophiliacs and clients that have cystic fibrosis, it is a lifelong benefit. And so is there a specific type of the benefit that they want to talk about?
No, they do not, but I will let that attendee know that if they do reach out to me, I can certainly put them in touch with someone from CSHCS if they have any questions. And I'd just like to say that I can finally now say that, right? That's a tongue twister, and I'm sure you get good at that working it for the program. Is there anything else? Oh, go ahead, Sue.
Can I just say something quickly? I just want to say thank you on behalf of the Michigan's bleeding disorders community for the programming and the services that are provided through both Children's Special Healthcare Services and the Medicaid program in the state of Michigan. We're all very grateful. And I'm sure Sarah has expressed that to you many times in our work. So thank you very much.
I should say is that CSHCS is a program within the state health department that while we are within the Medical Services Administration, we are not Medicaid. And so as a result of that, we do provide coverage to people who are based upon their diagnosis and not based upon their income. And so I think that's an important factor of how we differ, and those costs are then covered by our Title V funds instead. And so about 60 to 70% of our clients may be dually enrolled and receiving Medicaid benefits. There is a portion of the population, about a third of the population, that actually is enrolled in other health insurance programs and or is not enrolled in any health insurance program, but receives coverage for their hemophilia condition through the CSHCS program.
Thank you so much, Theresa. Thank you, Jackie, for sharing those updates. There are a lot of updates, and I really appreciate that. Again, remember, all attendees, you can go online and take a look at these policies. There are opportunities for you to comment. So with that, we'll continue on. I wanted to share with you all, we were supposed to have our colleague at the National Hemophilia Foundation, Bill Roby, join us to share an update about what the National Foundation is doing, how they have shifted their work slightly. And unfortunately, an emergency came up with Bill and he's not able to join us. But I'd just like to say that NHF also is able, they share a lot on their website. I know recently they updated their advocacy page to share some of the things that they have done. It addresses a lot that's going on, of course, at the federal level, where today we're focused a bit more on the state level. So if you are interested, I do suggest that you go on to NHF's website and HFA's website and see what's going on. So sending him positive thoughts. Now I wanted to say, we've shared a lot of information with you. What can you do, right? I think that it's really important for us to continue our advocacy efforts, even though, you know, we're focused on the COVID pandemic right now and a lot's been going on. We need to continue to share our voice and speak up and share our needs for the bleeding disorders community. HFM has a wonderful new advocacy page that makes it really easy for you all to connect with your representatives. I do have one more poll that I wanted to share with you, and this will also see if you are all still paying attention. But I wanted to ask you all if you've participated in any of these advocacy efforts in the last 6 months. Some of you might be, I know, are pretty strong advocates and have done this work. But maybe some of you haven't done any of this yet, and we're going to talk about ways that we can do it. Wow, 3 people wrote an email or letter to their representative. 7, that's great. And I recognize some of you may not vote if you have not engaged in any of these activities, and that is fine. I'm just giving it another moment for anyone else who'd like to share their answer in the poll. Okay, let's see it. It looks like most of you wrote an email or letter to your representative, so that's great to hear. Some of you attended a live or tele-town hall. Great. Okay, so if you haven't, or if you have, I'd like us to continue working to connect with our legislators. You know, right now, as Keith mentioned earlier, a lot of them are working from home. They're not in session right now. It might be a great time for you to send them a message. So if you go on to hfmich.org/advocacy, we have great tools here. You can click to contact your local representative, which will take you to this other page where you can actually look up your representative, though I am sure many of you do know. If you don't happen to know, they do change. Feel free to use those tools and find who your representative is and who your senator is. And I wanted to talk a bit about what we say now, right? This is not the same as Lansing days where we might have an ask that we call it in advocacy, where we're going into an office and we have a very specific point that we either want to get across to them or ask them to do something for us. And we might not have that right now. And the important thing to remember is that we don't need it, right? A great way to build a relationship with a representative, your elected official, is to not always ask them for things, to sometimes just reach out to build that communication. And so here are a few talking points. If you do want to, you know, take a screenshot, write some notes about this, it's really just introducing yourself. You can share who you are, share that you're part of the bleeding disorders community in Michigan. I think that it would be great to let them know that normally we visit the Capitol every May to visit with our representatives and share information about our community, and say that we couldn't this year due to COVID, and that, you know, we're upset about it. We really wanted to talk to them. I suggest saying a thank you. We are all doing a lot during this time. It would be a great thing to share with your elected official, because they are still working for you, right? They are doing a lot right now. So you can just share a simple thank you. If there is something in particular that you have noticed and you would like to thank them for, you know, making it specific and personal is always a great thing to do. And then, you know, end it by saying, I'd like to talk to you soon. Maybe we can schedule a meeting when things start to open back up. Maybe you can mention that you'd like to schedule a different meeting via Zoom. Any way to just say, hey, I'd like to continue this relationship with you. And you can share this via an email or calling. Some people feel better sharing emails. If you're one of those people who does like phone calls, I know Sue loves to just pick up the phone and call. Those are just great ways to get your message across. I also wanted to mention a few other ways to connect. So right now, your legislators are actually great tools for you. As we heard from Theresa and Jackie, there's a lot going on. There's a lot going on in the legislature as well. There's a lot going on with the federal government. A great thing for all of you to do is to sign up for your legislators' email list. I have an example here from Congressman Fred Upton. He just happens to be one of the many, many different elected officials that I have signed up for emails from, and he shares information every day. I know that Congresswoman Debbie Dingell also does the same, and so do our state representatives. So if you sign up for their email list, or maybe also an email list of someone else across the state, it doesn't have to be just your elected official. That's a great way for you to get these updates on what's going on. It's just really been helpful for me. They'll share links. They'll share both what's going on in Michigan and what's going on at the federal level if you are following one of those federal representatives. They're also shifting as we are. We're not in Lansing today, and they're not holding town halls in person, but they're still doing a lot. I think there might be even doing more sometimes because what's going on is so overwhelming and intense for all of us. So see if they're holding a town hall, a tele-town hall, as you will, right? I've known that my representative has done one on Facebook Live. Sometimes you can call in to do that. My Congresswoman has done that as well. This is just another way to get information for them, right? Using them as your tool. And then social media. I'd like to just say something about social media, though, that we've been hearing, I think, over the past few years from our elected officials, is that it can be quite noisy, right? The internet is vast. Social media is very interesting. There's a lot of talk. So it is completely fine and wonderful if you want to give a shout out on social media, if you want to tag your representative, but they might not always see it. So if you'd love to do that, great, but follow it up with something else, right? Say, you know, I messaged you on whatever different platform you're using, and then write a little bit more. As always, we like to keep it nonpartisan and try not to yell or criticize, and keep it pretty kind and respectful. That is the best way to actually get them to respond and listen to you, right? Even though sometimes we have a lot of emotions and feelings, take the time to actually calm down if there are emotions going on, and write it out, to really be respectful for that. Okay, and with that, I think that we are going to end slightly early, but I do want to leave time for questions. I do want to remind you to go online to hfmich.org/advocacy, because we have a lot of tools for you there. We do outline different priorities, different issues that we've been looking at. There are explanations there. We have the way to connect with your state senator and state representative. We have more information about the Health Can't Wait Coalition. As I mentioned earlier, that Senate Bill 612 is on hold right now, but we want to start thinking about when we'll be back and advocating for it. So if you're connecting with your legislator now, that's going to set us up in the future for when we want to make those asks, right? We don't always want to ask, so maybe start now and just say hello. I think that that would be a great thing for every single one of us on this webinar to do. Does anyone have any questions, or do any of our panelists have anything else they would like to say?
Oh, I'd like to say thank you to Sarah Precario for her dedication to our advocacy program and building the relationships that we have been able to do these last few years. She does a terrific job. So thank you very much, Sarah. And in addition to looking at our advocacy page on the website, she's also very involved with communications. So there are several other events and activities coming up that we invite you to consider, you or your family, over the next few weeks. And we are grateful to our community for your engagement and involvement, and to the leadership at our state, and certainly our financial supporters.
And I shared my email here if anyone does have questions after this about what any of our speakers shared or about what I've shared. Please feel free to contact us. You can contact Sue as well at SLERCH, SLERCH, at hfmich.org. And if you do contact your representative, I'd love to hear about it. So shoot me a message as well. Thank you all. Thank you, Sue. Thank you, Theresa, Jackie, Keith, and thank you to all of our sponsors. Thanks all. Have a good evening.
Thanks, Sarah. Fabulous job. Thank you, Theresa, Keith, and I think Jackie's gone. Theresa, you did a terrific job.
Okay, I'm going to end the call now.
Oh, I was going to say, thank you very much, Sarah. You did a great job.
Oh, thank you.